mental health, mental illness, mental imbalance, mental issues, mental this, mental that. Once we hear mental, the next thing that comes to our mind is that the person has gone what? Nuts. The person don't kolo. That's the next thing. Before you complete the word mental, the next thing is, hey, it is madness. So what is mental illness? What is mental health? Maybe if you understand what they are, we'll have a different attitude towards the people around us and what they are going through. World Health Organization talks say mental health na your state of complete wellness spiritually, physically, materially, and otherwise. When we are talking of social well-being, you know what that means. All your relationships around you are healthy. When we are talking of spiritual well-being, you know what that means. You get correct relationship with the higher powers where they guide you. And then we are talking about physically, you are fine. Socially, you are fine. Emotionally, you are healthy. Looking all around you, all these parameters must be put in place. Not be when small money dey your pocket too. As in, at that point you are thinking of nothing. You are all round complete. That is when we can say you are mentally healthy. Not just the absence of a mental illness. Meaning that as I'm talking to you now, simply because I am not on the street, simply because I am not mentally sick, or nobody can say she has this mental disease or the other. I am talking like someone that is normal, yes. Simply because I am talking to you and there is an absence of mental illness now, does not confer to me that I am healthy mentally. Does that make sense to you? Wetin I dey talk be say each and every one of us, both me wey dey talk to you and you wey dey watch me, all of us get one different level of mental illness or the other. Now wetin I dey try talk be that. How the thing sound? No. I am not insulting. But the truth is this. It is difficult to say you are completely healthy when it comes to mental health. Looking at that definition where WHO give. Why is it so? It is so because there are two important chemicals where they control wetin dey happen for inside this our brain. Two of them, we call them neurotransmitters. You have the dopamine and then the serotonin. These two, depending on their level at any point in time, will determine whether you dey normal or you no dey normal. And there is just a thin line between what we see as being normal and abnormal. Just a thin line. So you can actually snap within any moment and then cross the line to the other side. But the good thing is, you can cross momentarily and then come back to where you're supposed to be. Your ability to cross and come back being able to maintain that equilibrium and still behave like normal human being makes you balanced. The difference between you and that man on the street is that he is not able to return back to his normal state of being. After he snapped, he was not able to return. That is just the difference. So at every point in time, when that man wanted to badge your car, even though you were on your right lane, and then you came out, and then began to exchange words with him, you could tell. In fact, my friend, I was mad. For that 5 minutes, I didn't know what I was. At that time, guy, wetin do you kolo? That's what I'm trying to say. So at that time, you cannot say you were mentally healthy. And because you were not mentally healthy, at that time, you behaved like that madman on the street. But the difference is that you were able to come back to the real you. From that place you snapped to, at that moment, you were able to come back and now you behave like a normal human being. Now, the man on the street is not able to recover himself back. And that's why he is on the street. And now it is that inability to recover back that we are looking for. You and I should be on the lookout. Such that rather than discriminating about them, rather than stigmatizing them, we should know that it is just a process. All they needed was help. And the moment they come to the healthcare providers, what they do is to look at these two neurotransmitters I talked about bring them back to their normal levels, and the person begins to function well again. So the fact that somebody has ever visited the psychiatric hospital does not mean he cannot function well in life anymore. If you were a lecturer, you can still lecture well. If you were a doctor, you can still perform your surgery well. If you are on your medications, because it is a lifelong treatment plan you're going to have. So all you need to do is to see it as normal illness, like every other illness. Your heart gets sick, you are not ashamed to say it. Your legs are sick, you're not ashamed. Your immune system, everything about you can fall sick and you are not ashamed. People have diabetes, they have all manner of things. Nobody complains about them. They'll tell you, it's a muscle problem, it's an autoimmune problem, this is what I have. And they are not complaining about it. They are not ashamed to say it. And nobody stigmatizes them. Okay, he went to the hospital. What happened to him? Oh, he had typhoid, he had malaria, he had liver cirrhosis. They said it is kidney problem. Okay, this, nobody is stigmatizing you. But the moment you say, he went to a psychiatric hospital, hey, it runs in their blood, oh, please don't go close to them. No, the brain can be sick, just like every other part of the body can be sick. And so the moment the brain is sick, all you need is to raise alarm, get help where it is necessary early enough to prevent further damages being done to that brain. If you could get those people early enough, the moment they began to snap, and that snapping can be a little aggression, it can be depression, it can be somebody withdrawing from the things he normally loved to do before, and then he had become withdrawn. He never finds anything pleasurable anymore. It can just be depression. It is a psychiatric problem. It could just be a little aggressiveness. He becomes too aggressive than ever before. He begins to do things he wasn't doing before. A little child begin to break things in the house, begin to break the television, begin to set the house on fire, and you feel, he was just annoyed, he was just angry. My dear madam, please bring him. We need to examine this child and we need to help him. Stop stigmatization. Let's know that every part of the body can be ill, and there are medications, there are treatment plans for every part of the body to be restored back to normal. That is why I'm bringing this video to you. Stop stigmatizing against those who have mental illness, because every one of us perform or manifest one form of mental illness or the other at different times. And we have not been stigmatized because our own have not gotten to that level. So please, before it gets to that level, raise an alarm, get help, restore the person back to normalcy, and life goes on. Brain illness is like every other part of the body falling sick and needs help. Stop stigmatization of psychiatric patients. Thank you.